I'm going to warn you today about Ozempic, Wegovy, Mounjaro if you're considering having cosmetic surgery. There's been a lot of buzz around these medications in terms of losing weight, but I'm going to go through the potential complications that are associated with these drugs. Some of them are expected, but there are some unexpected complications that may arise if you're considering having cosmetic surgery. And I'm going to give you my opinion about how to approach taking these medications or stopping the medication prior to having a cosmetic procedure. So let me tell you how Ozempic, Mounjaro, or Wegovy work. They're part of a class of drugs called GLP-1 inhibitors, which mimic glucagon, which is a naturally occurring protein in our gastrointestinal tract. It lowers blood sugar by stimulating the release of insulin, and it also slows down the gastrointestinal tract so that you feel full, you have a loss of appetite, and it also has an effect on dopamine in the brain so that you have less desire to eat. According to a study which was done over a longitudinal period of time, a long period of time, there was about a 15% loss of weight. If people stop taking it, they'll regain the weight. So this is a long-term commitment to taking these types of medications to lose weight. It may be a lifelong commitment. There are short-term side effects and medium side effects and long-term side effects. So let's talk about the short-term side effects from this class of medication. You can get nausea, vomiting, diarrhea, and constipation. Constipation can be a particular problem in patients who are considering cosmetic surgery. Why is that? Well, the reason is because the food that you eat can be retained in your gastrointestinal tract for a prolonged period of time. So that when you're preparing for surgery, say you're thinking of having a facelift, or you're thinking of having your eyes done, or you're thinking of having an abdominoplasty, a tummy tuck, and the usual recommendation from most surgeons is that you have nothing to eat or drink after midnight the night before surgery. The problem with that is that there may be food still remaining in your gastrointestinal tract on the morning of surgery. Why is that of significance? Well, we want patients to always have an empty stomach prior to surgery because that food can be regurgitated while you're going under anesthesia, and you may aspirate into your lung this fluid, which could have a detrimental effect on your health, could actually kill you in some cases. So the new recommendation that's emerging for Ozempic, Wegovy, Mounjaro, any drugs similar to this, which could slow down your gastrointestinal tract, is to actually be off the medication, believe it or not, for 4 to 6 weeks prior to the procedure, because Ozempic and drugs like it have a long-term effect on the motility of your gastrointestinal tract. We want to keep you safe. I understand that you all want to keep your weight loss off, but at the same time, we want to make sure that you are safe if you're contemplating having a cosmetic procedure, and we don't want you to aspirate during the procedure. So therefore, you have to stop the medication at least a month to 6 weeks prior to the procedure to be sure that the motility in your stomach returns to normal and you have an empty stomach. Another long-term problem that may arise is that there is facial fat all over our face. So there's fat in the temples, along the jawline, below your eyelids, in your cheeks. Everywhere in your face, there's fat pads. And if you lose a lot of weight with Ozempic, you will lose weight in your face as well, because there are fat cells there that are going to respond to the medication. So if there's an extreme loss of weight, it will affect the fat in your face, and you may look gaunt, you may look hollow, and you may look like you're sagging. Now, this is not unique to just these medications. I have seen this occur in people who have had bypass surgery, gastric bypass, to lose weight. They also lose a lot of weight and they become gaunt. Even in people who are avid runners, they lose so much body fat that the fat in their face also diminishes. So this is not something unique just to these drugs. It occurs in anyone who loses an extreme amount of weight, especially in people who are middle-aged, because younger people have better elasticity to their face, which retracts if they lose weight. But people who have natural loss of elasticity due to loss of collagen and elastin, those patients are going to see more sagging and hollowing, and aesthetically they may not like it. Another cosmetic procedure which usually accompanies facelifting is fat grafting, taking fat from your belly, your hip, or the inner thigh and grafting it to your face for volume replenishment. In those patients, the fat also that's been grafted from your belly or your hip to your face may diminish due to these drugs. So that can be problematic in terms of the ultimate result you want to achieve during a facelift or fat graft to the face. You have to understand that it's going to respond to these weight loss drugs. So all these things have to be taken into account in advance. And it may be that you may actually have to discontinue the use of Ozempic or drugs like it because it may cause too much fat loss. So these are serious things to consider when you're considering having future cosmetic surgery, and patients who lose weight also want to have a rejuvenated appearance elsewhere, and therefore you really have to think about the implications of taking Ozempic while considering having those additional procedures. And that has to be brought up with your plastic surgeon at the time of, or prior to the procedure, actually. And so if you have any further questions, please leave them below. I'm happy to answer your questions. Please subscribe to my channel, and I look forward to seeing you in my next video.